Samoa is a small island nation in the Pacific with a population of about 200,000 people. It's a nation that is being affected significantly by high rates of non-communicable diseases, such as diabetes, cancer, cardiovascular and respiratory disease.
Non-communicable diseases is one of our main problems in Samoa. It has increased in number in the past few years. So our main approach is our primary health now is to target diabetes, hypertension, obesity, and all those other problems.
Today, Seve and her team of nurses are on their way to a sports gathering in a remote village. Seve and her team work for the National Kidney Foundation, and they're on their way to the village sports tournament to run health screenings. The National Kidney Foundation is assisted by the Samoa Sports for Development program, which is supported by the Australian government and runs programs across the country.
How we were able to get here today is working in partnership with the Ministry of Education, Sports and Culture, with the Samoa Sports for Development program, sponsored by the Australian government, and so we're able to partner up with them, and they make us able to come here to Savaii and to provide the services for the community in Savaii.
Today in this village, the Samoa Sports for Development program is running a volleyball tournament. The National Kidney Foundation team is able to screen those who have gathered for the sporting event. The first one to get screened today is 30-year-old Liti, who has come from a nearby village.
It's good to play sports and have the NKF came and do the test on everybody, because I believe if it wasn't for the sports, NKF wouldn't came and help us and do all the tests and make sure we were all healthy and stay healthy.
The National Kidney Foundation screening figures show that 42% of the Samoan population suffers from hypertension, and rates of obesity and diabetes are extremely high.
We screen for blood sugar levels, cholesterol levels, and mainly to screen for diabetes and high blood pressure, because these are the two main NCD diseases that result in kidney failure. So it's part of our prevention of end-stage renal failure and ending up in dialysis.
In Samoa, non-communicable disease is a major problem, and combining sport and health awareness is important.
I think sports make people more willing and more happier to come and attend and have the screening at the same time. Otherwise, without the sports, it's hard. People are very reluctant to come and have a health screening.
NCD screening program that's running at the moment, done by the NKF, it is very important so that we can catch or we can diagnose people with hypertension and diabetes early, so that we can treat the disease aggressively and properly, so that all the complications of diabetes and hypertension doesn't arise.
Many factors make accessing rural villages a challenge, including location, expense, and the traditional Matai chief system of Samoa. Without the support of the Samoa Sports for Development program, it would be very difficult for the National Kidney Foundation to access villages at the community level.
Normally we would be able to access the community because NKF wouldn't be able to go out into the community directly.
So we make it easier for the National Kidney Foundation to get access to the villages, and we make it easier for the people of the villages to get this opportunity to be screened and tested.
It is very important for sports to be involved in the village level. It's because that's where all the people are living. So if we start from the living environment, then we can make a lot of change nationally.
The Australian government supports the program to run sports activities targeted at increasing levels of physical activity in regional Samoan villages, and by using sport as a way of bringing people together, the National Kidney Foundation is able to screen a large number of people in a relatively short time. The message that sport is important and is good for your health is helped by the National Kidney Foundation getting out into the community to run screenings like these.
The importance of physical activity is very important in the for the lifestyle of people in Samoa as part of preventive efforts to reduce obesity, which is climbing still in Samoa, as a way of preventing NCDs. So physical activity is an important part.
The mission of the program is to not only to get the people to participate in sports, but behind it, they are helping. The program is helping them with their health, especially with decreasing the non-communicable diseases like high blood pressure.
We've been able to screen people nationally across the country, Samoa, approximately just under 2,000. A lot of people appreciate being able to come here and for them to be able to access to the service. Otherwise, they wouldn't have been able to come themselves to the health facilities or to the hospitals to have a checkup. The community are quite appreciative of being able to come directly into their community with the service.
I believe we're all happy because NKF is here to help us and give us the test.
It's a positive response from the participants. They got the opportunity that they can be screened and tested and get advice from the doctor. And some of them thought that they were not sick, but then when they got screened and tested, the advice was you got high blood pressure, obesity or whatever, and so now they are aware of it.